Hello everyone. In this presentation, we will discuss some important facts related to COVID-19 under the following headings. The introduction part, timeline in which we will focus how it all started during the first wave, then the clinical features we should look for if we are suspecting COVID, then tests available to diagnose the COVID infection, and the treatment options that right now choices that clinicians have for the management of the patient, and vaccination part, though many of them are still in pipelines, but we will discuss about those which are available right now in India. So we can discuss each of these topics for hours, but here what I have done is that just touch the superficial important knowledge to give you all the basic idea of the disease. Let us begin with the introduction part. As we know, this virus belongs to the coronavirus family and is a beta virus which is enveloped and contains single-stranded RNA as the genetic material. It has proteins. The most important one is the spike protein, which helps it in attachment with ACE2 receptor of the host cell. Then matrix and envelope protein, which requires for the reassembly and structure rearrangement after the virus multiplies itself within the host, and nucleocapsid protein. Both of these envelope and nucleocapsid protein for gene encoding these proteins are targeted in RT-PCR technique. The most widely spread strain across the world causing this infection is D614G, and officially the virus is named as SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2, and the disease is named as COVID-19, which stands for coronavirus disease, where 19 stands for the year of its discovery. The mode of transmission of infection can be direct through droplet or direct contact, or can be indirect through droplet nuclei, fomites, or unclean hands. Now, here I will like to differentiate between the droplet nuclei and the droplet. So basically, droplet nuclei is different from droplet, as these are very fine droplet which can travel from one place to another along with the airflow. That is airborne infection, which has been discovered in the recent studies. In the timeline section, I will be discussing how it all started during the first wave mainly. Right now we are in the second wave of the pandemic. So let us recall the important dates. On 31st of December, WHO was alerted for several pneumonia-like cases in Wuhan city of China country. On 7th Jan, China confirmed that they have isolated a new virus. On 11th Jan, WHO issued first package of guidance how to tackle the emerged virus. January, so basically January was the month when many countries of the world got alerted. On 30th Jan, WHO declared it as a public health emergency of international concern, and coincidentally India also confirmed its first case on the same day at Kerala. On 11th of March, WHO declared COVID-19 as a pandemic. So a disease is endemic when there is increased cases than the normal numbers within a particular region, and it becomes a pandemic when the disease is spread over the other continents basically. On 25th March, India announces its first nationwide lockdown against COVID-19. So the WHO was criticized for the delay in declaring the threat. As we can see, there is a gap around 1.5 months in between the emergency announcement and the pandemic announcement. And also, India during the first phase reacted very late, which gave the virus the chance to invade the large population, and it spreads that much. So Now we will see some clinical features. First, I will discuss the common ones. The fever, which is a most common overall. Approx 80 to 90% patient complains increased body temperature, then dry cough, breathlessness, which is seen as the disease progress in moderate to severe cases, sore throat and fatigue, then anosmia, which is loss of smell and is very consistent among the all features. Then some uncommon features are headache, GI symptoms like vomiting, diarrhea, ageusia, which is loss of taste. The average incubation period of the disease is approx 7 days and can range anywhere in between 2 to 14 days. And in the second wave, headache is seen in many cases, and also the virus invades lungs very fast. Uh, say within 1 to 2 days, saturation falls drastically. We have seen that. Now we will discuss how to diagnose the COVID-19 if someone is having the symptoms. So I have discussed it under three headings. The first one is genome amplification techniques, which includes the RT-PCR, which is the gold standard, and it takes around approx 12 to 24 hours to generate its report. Then we have real-time RT-PCR and qualitative RT-PCR, which detects the virus in real time, and hence it is fast because as soon as the virus amplified to a certain threshold level, it shows up as a positive test. So the other there are some other genome amplification tests like TrueNet, CBNet, and which gives results within hours. And then there is a Feluda test, which is CRISPR or Cas9 based test, which is unique as it detects palindromic repeats. And in India, it is developed by CSIR and Tata Group and has been approved by the government of India. Then we have some antigen based techniques. RAT, which is rapid antigen test, which is preferred for screening and it gives result within minutes, and it is used for early diagnosis. And recently in India, Coviself, which is developed by TIME-LAPSE, is approved by ICMR for home testing if someone is symptomatic. Then we have ELISA and CLIA based antigen testing. Then we have antibody-based techniques, and the antibody testing has role mainly in the post-COVID period if someone wants to check his or her antibody levels, and if someone is suspecting infection in past, can go for the antibody testing. And in antibody testing, we have IgG, IgM. Either we can do a separate test or both of them simultaneously also. Then we have ELISA, CLIA-based, and in India by ICMR and NIV Pune, they have developed Kavach Alexa, which has been approved by the government for use. So now we know that the most preferred sample for the testing is either nasopharyngeal or oropharyngeal or both samples. Bronchoalveolar lavage samples are not encouraged, that means due to the production of aerosols. For antibody testing, as it is present in the systemic circulation, we take the blood samples. So in this second wave, the government of India emphasized on early diagnosis so that the cases can be isolated and managed at the earliest. And hence, antigen-based techniques, which are RATs, are more encouraged over RT-PCR and other genome amplification techniques, which take some time. But if someone has got RAT negative and is still symptomatic, he or she should definitely go for the RT-PCR for confirmation. Now we will discuss treatment options available and the vaccination part. So basically, we have divided the patients into three groups. The first one is a mild one, where saturation is more than 94% and respiratory rate is less than 24 per minute. They can be managed symptomatically. either at home or at a dedicated COVID isolation areas. Then second one are the moderate category where saturation is less than 94% and respiratory rate is more than 24 per minute, and they may require oxygen support, steroids, which is the only drug saving patients' lives by reducing mortality. But we have to use judiciously, and decision whether to use it or not is totally depends on clinical condition of the patient. Because in recent past, what we have seen that many of the patient who were treated with extra dose of steroid, they have came up with a mucormycosis, the deadly black fungus infection due to the steroid abuse. So we have to use it cautiously. Then anticoagulants again should be started after the risk assessment for DVT or thrombus formation, and in patients who have and non-ambulatory. And some antivirals are there like remdesivir, favipiravir, trastuzumab, and all of them have to be used in a eligible patient under the guidance of a medical practitioner. Then third category is severe categories patient where the saturation is below 90% and respiratory rate is more than 30 per minute. Apart from all the above options available, they require intensive care and monitoring. Ventilatory support may be needed if the condition deteriorates further. Now we will discuss the vaccination part. As of now, three vaccines are approved for use in India: the Covishield, the Covaxin, and Sputnik V. So Covishield, which is a vector-based vaccine, um, and Sputnik V, which is also a vector-based vaccine, and Covishield is developed by the Serum Institute of India, whereas Sputnik V is manufactured by Dr. Reddy's in India, whereas Covaxin, which is an inactivated vaccine, is developed by the Bharat Biotech and ICMR in collaboration. So the gap between the first and second dose of the vaccine is minimum for both Covaxin and Sputnik V. For Covaxin, it is 28 days. The gap between the first and second dose is 28 days. And in Sputnik V, the second dose can be taken after 21 days. But for Covishield, it was 6 to 8 weeks in past, but recently the government has increased the gap between the first and second dose to 12 to 16 weeks, and all of them a temperature of 2 to 8 degrees C for their storage. In other parts of the world, mostly in developed nations, three other most commonly used vaccines are Moderna, Pfizer, and Johnson and Johnson, where Moderna and Pfizer are the messenger RNA-based vaccines, which is responsible for their high efficacy also. And I have not included them here because they are not being used in India, and because of their requirement of very low temperature storage, and which is in minus degrees. For say in Pfizer and Moderna, it is around for both of them is around minus 70 degrees centigrade, and to maintain that cold chain throughout the distribution is not possible for any developing countries like India. So that's all from my side, and thank you for your attention. If you have any queries, feel free to ask me in the comment section below, and I will try my best to answer them. And do like, share, and subscribe the channel for more contents like this in future. Stay healthy, stay blessed. Goodbye.